First of 3 special tests for the hip is to mark out any potential pathologies. So we're using this as just a pre-screening. So remember, if there's any pain present in this is our sign to refer out, that we can't deal with it. We can see restrictions and we can deal with the restrictions, but that's pain-free restrictions. If there's any pain present, that may be an indicator that there's a deeper injury that we can't deal with. So first one's our FABER test. Stands for Flexion, Abduction, and external rotation. So in this position, I'm pretty much going to get them into a figure 4. So ankle on the knee like so. What I'm going to do is I anchor the opposite hip, so I'm not getting any spinal or hip rotation, and I just want to see how far this hip rolls out. Okay, so we've got good flexion, but our abduction and external rotation is limited here. So this could be a sign that the adductors need some work, but if there's no pain presence, that's okay. So I'm looking for asymmetry. Remember, FABER, flexion, abduction, external rotation. Anchor the opposite hip, let it drop, give it a gentle push if needed to see the tension. That's our FABER test. Second test is the FADDIR test for femoral acetabular impingement, FIA. So FADDIR stands for flexion, adduction, and internal rotation. And if I just sort of push and guide into the knee across the body like so, if they do have FIA, the impingement of the hip, they will feel a compression in there very early on. If someone has a pathology here, it'll be almost at the point where you combine the adduction and internal rotation. As soon as you start to do that, they'll feel it. But if you can get right across like this before the hip moves, we're all clear. Just compare it to the other side. So remember, FADDIR is flexion, adduction, internal rotation. They will feel pain if they do before that point. So if they get to the end of the FADDIR acronym, we are all clear. The last special test for the hip is called a FABER test. FABER test is testing the piriformis, the main or big primary external rotator of the hip. FABER is an acronym too. So in this position, we're going to go into flexion, adduction, and internal rotation. Okay, so again, we go flexion, adduction, internal rotation. If we've got a tight piriformis, we won't be able to get that far. Okay, we might show signs of what we call piriformis syndrome, where if we get to adduction, they might feel a bit of, pressure, but definitely as we start to add that internal rotation, they'll feel it fire off.